Hi. Hello
Hello.
again. How are you?
Good. How are you?
Also good. You asked me today, like, if we're recording because you saw I had a tough night. I have a
Yeah.
tough night every night. you know? Yesterday was just extra tough, but yeah, I really have a tough night every night. So,
What happened yesterday? What made it extra tough?
vaccine. She got a vaccination yesterday morning. It's the second round. So she had the first round a month ago. I think it's every month she gets vaccines now, actually.
Oh,
Yeah.
I think the vaccination program in Portugal and Germany is different. We didn't.
Really? How
Yeah.
does it work then?
I think the vaccines themselves are the same, but
Hmm.
sometimes different brands means you have two doses instead of one, or the timings in between
Ah,
are
okay.
different. So the protection for the diseases, I think it's the same at the end. I had my pediatric sister-in-law check, and she's a pediatric doctor in Germany, and it's pretty much the same, but the timings are different. So we didn't have it every month. I think we had it every 3 months. I think something like this.
Oh,
And then
wow.
it goes.
No, I got a, yeah.
It goes over. It starts to be more and more time in between the vaccines. So when she turned 1, that's when she had the most. Was horrible. She had 5 vaccines. So we had to ask the doctor to please make it in 2 times, give her body a break in between, because 5 vaccines in one appointment feels like abuse, honestly. But she needed to get the 5, and now it's only
Her very first vaccine was 8.
8 vaccines.
And that was the
Wha-
first time when she was like 2 months old.
8 vaccines.
8.
Wow. Like,
Yes.
wow. I'm in
Yeah, I think
shock.
it's ridiculous. So the very first time she got a vaccine, it was a combination of 8. Then a month later, it's a reminder. And every month until August, she has a vaccine appointment. We have to go there every single month.
Wait, she
I
was
think it's
poked
ridiculous.
8 times?
No, no, but she got 8 different vaccines. They're combined somehow.
Okay, okay, but they like the injection was not 8 times.
No, no, there was somewhere
Oh,
injections, somewhere something to drink as well.
okay, 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 okay. I was like, my
Yesterday she
God, the
also
poor
got a
child.
combination of something. Yesterday she got one injection and one like drops or something.
In the arms?
No, in the leg and the
Yeah.
drops.
Yeah, okay. Yeah, yeah.
But
Yeah, I
she
don't
was
know.
crying all night.
It's it's difficult. And the first time my daughter had vaccines, no one told us really about giving her paracetamol. And then the
Oh, really?
doctor, yeah, I don't know why. It was we were caught by surprise a little bit, because at the appointment the doctor said, if she has fever you can give paracetamol, and then just before we left she said, you know what, you can just give paracetamol. And I'm like, I found it strange, should I just give it to her? And she said, yeah, you don't need to wait, you can just give it to her. But she made it like, it was so informal the way she said this. I didn't
Yeah,
really take
yeah,
it serious. And then we came home, she was fine. An hour later, dear Lord,
yeah,
it's like,
yeah,
what is
yeah, yeah.
happening? She was crying and screaming, and I was crying. My husband was almost crying. Like, what the hell is going on?
Yeah,
And
yeah,
then we
yeah.
gave her paracetamol, and she was okay. And I was like, why didn't
But
they?
how did you give her paracetamol?
We used the liquid one, like
Okay, because
liquid.
for us, the doctor said she may cry, she may have a fever. I'm gonna
Mm.
prescribe paracetamol inception, so it's something you put in the ass. I don't know how to say it in English.
Yes. So
Yeah.
yes, they also told us about both options. The thing was, the doctor said the liquid one is easier to dose when they are so small.
Mm-hmm.
So we went with it, but for some babies it's a challenge because they spit it out.
Oh,
So
yeah,
I
yeah.
bought both, and
Mhm.
I said, okay, let's try the liquid first. And we tried the liquid, and she actually took it. Since then, we always gave her liquid. We never used the other one.
Okay. No, we always just we change the diaper, we just put one in.
Okay.
So yesterday, last time with the vaccines, we only had to give her one. Yesterday we had to give her two. So we gave her one. We got this vaccine in the morning. We gave her one in the afternoon, and then in the middle of the night, it was so horrible to watch because she would like wake up, cry a bit, like literally like scream, turn around and fall asleep, scream, turn around and fall asleep. It was like,
Maybe.
yeah. So we had to, because I was like, oh, because it was so like a jerky movement, like she would like, it was so fast,
Yeah.
but it was happening a lot, in a row. So I was like, no, she's struggling. Let's just give her, and
Yeah.
no need for her to struggle.
Yeah.
Yeah. So,
I
but
struggle when it comes to, I'm always like avoiding as much as possible to give her medication. And my husband says sometimes we push it too far. And it's true, like, I'm, especially then when the teeth thing comes, we got to a point where we're like, you know what, it's okay. And that all the doctors we talk to, they say, it's okay. Just, I don't have to
I mean,
wait.
it's even okay to take paracetamol in pregnancy, right? So,
Yeah. Yeah.
yeah. I was also like very against any medicine or medication when I was pregnant. That's why I was like in the very beginning, I was just vomiting my everything out. And then I realized, okay, I can't live like this. So I did some research, we tried the different pills, and then we found one that works. And then, for whatever reason, I had to take lots of medication during my pregnancy. Actually, there is a website in Germany, at least, where you can check what medication is safe. Even some antibiotics are safe during pregnancy, which blew my mind when I found out. But yeah, I feel better about this now. And I also, she can sleep at least, so yeah, why not? Oh, that's my cat. Did you hear my cat or not?
I heard, but my emails went off at the same time. But I heard.
Yeah, I also have a baby on screen, so I was like, is it the baby or is it the cat? It's the cat. Baby's still
Yeah.
sleeping. But if she wakes up, I have to go because she's still having a hard time after this vaccination.
You gotta do what you gotta do.
Yeah,
That's
maybe it will be a short episode.
Is breastfeeding helping? With my daughter, it used to help with the discomfort.
But what? Sorry?
Breastfeeding, like putting her on the breasts.
Yeah, like I tried last night, but she would eat, and the second time when we decided to give her the medicine, then she wouldn't take it.
Okay.
She was just unsettled. Yeah.
Yeah. Poor
Oh, no,
baby.
she's
It's a lot
sleeping.
to go through. She just came into this world.
Right? Yeah. I
Yeah.
feel like it's maybe too much for, especially that we don't really go anywhere, we don't take her anywhere.
Yeah.
And
Still, it's better to suffer through the vaccination than suffer through the disease. That's
yeah,
what I always told
yeah, yeah,
myself.
yeah. I agree.
Yeah.
Actually, someone in the pregnancy group asked about like baby excessively screaming. And I don't know if you know, but there is something in Germany called Schreiambulanz. So basically, if your baby is screaming and you can't do anything, you can't find a reason, it doesn't stop, you can
Yeah.
call this Schreiambulanz, so like screaming ambulance,
Yeah.
and they will help you. They will you can go there and they will maybe help you somehow, solve it somehow, or find a
Oh, wow.
reason, or calm down, or like so you can have a break.
Wow,
I
that's
just
amazing.
I'm talking about it because they talked about it on the group. Then I remembered that I know how to solve this problem, and I just made some reels. I'll post it soon. But
That's awesome, actually.
right? Yeah.
It's always good to know that you have an option. But like here in Portugal, like I told you before, the pediatric doctor will give you their WhatsApp number immediately in the first appointment. So that would also help me feel more relaxed that I can reach out to a doctor anytime I need. Another thing, we have a phone line here where nurses and doctors answer the phone and they help you through. Should you go to the emergency room? Should you just wait for the doctor next day? Could you just go to the pharmacy and grab something over the counter?
Okay. For that, I
They
would
will
call my
triage
midwife
for you.
actually.
You what?
My midwife, Hebamme.
Ah, yeah. Okay, yeah.
Yeah.
So, no, this phone number is general. It's for everybody. Actually, you're not allowed to go to an emergency room without calling this number first. Of course,
Oh,
unless you're like bleeding or something.
yeah.
But normally, if you feel something and you are unsure if you should go to an emergency room or not, you should always call this number, and then they will let you know what to do. And if you do need to go to the emergency room, they will inform the hospital that you're coming. They will let them know that you are coming.
Okay.
Yeah, so it works for everybody. So it's something I could use also in case my baby's really. We had two scares where we had to call an ambulance for her when she was the first time. I think she was already older, not so much of a baby, but having a phone number that you can call or like help you can call when they're crying for no reason. That's
Yeah.
really great. Well done, Germany.
Actually, I didn't share this online, but after, maybe I shared it with you. After being released from the hospital, after giving birth, we stayed in the hospital for some weeks and then we went home
Yeah.
and I had to go back to the hospital for
Yes.
3 days. So, and I think it's great that you can just show up at the, at the not Aufnahme, so the emergency room, and
Yeah.
you don't have to call. We did call a midwife before because we were like, oh, maybe it's fine. And midwife was like, no, you have to go to the hospital. So we did go, and they took us for 48 hours. She had to be under observation. Then they released us, and yeah, then we got a breathing monitor. Yeah.
Scary things.
Yeah. Yeah, it's super scary, no?
Absolutely. Like everything, babies. That's one thing I wasn't aware before having a kid, how much anxiety comes with it and health anxiety. It's not something I really relate to before, like I with my own health or the people around me. But since having a baby, and we had a scare, especially we thought she was having a seizure. It's called like an absence seizure, where they're not shaking, but they're not responding to you. And we really freaked out. Like we called an ambulance. We were in the hospital the whole night. Was like it gave me so much anxiety to the point when we were at the hospital that I told my husband like I need to go outside because I feel like I'm gonna faint. I'm gonna throw up because I'm so anxious about the possibility of it being a seizure. And if it is a seizure, it may not be. Maybe the meaning that it could get worse or could happen again. And from then until she had like a brain scan to check for epilepsy, so we did like the full tests, which she doesn't. She's fine. Was probably night terrors, but in the moment looked a lot like a seizure. It was exactly the same symptoms. Like the anxiety is so
Yeah.
big, and then during that period, my daughter coughs a bit at night, and I'm immediately like alert mode, like the
Yeah,
whole
yeah.
time.
I know exactly.
It's terrible. My God, no one really talks about this. I have friends who have kids who are sick a lot, and I don't know if they don't share enough or if I wasn't conscious enough of it. I don't know if it was the same for you, but like there's so much anxiety around health. Oh, hi.
Yeah, there is. And you know what I wasn't aware of? The anxiety is one thing, but I have something called intrusive thoughts, and
Oh,
I cannot get rid of it. And I mean, she's already 3 months old. Oh, we talked about this, between 3 and 4.
yeah.
And I still have them, and it's horrible because my brain imagines the worst, and by the worst is like if I open the balcony door and I'm holding the baby, I already imagine the baby being thrown over the barrier and landing, and I see her on the ground bleeding. I see it. And my brain just, the more I think like about it, like shutting this thought down, the more it brings this image. I sit down and I think, oh, her leg gets trapped between my belly and my leg and it gets squished. Like I
Yeah.
have these intrusive thoughts and I see the end result without actually it happening.
Yeah.
And this is another reel I recorded today because in Germany, I'm gonna shock you now. So I pay hundreds of euros for insurance. Health insurance. It's like there is no option. Health insurance in Germany is is like you have to legally have it.
Yeah.
So I pay half, my employer pays half. And then
Hmm.
if you need help from the like a therapist or
Yeah.
psychologan or whatever, you can go to Hausarzt, to GP, and get a Überweisung to get it for free, right? But
Hmm.
in my area, so I went to, it's like southern Hamburg. I went to the doctor in southern Hamburg. They gave me a page. I made a reel about this because I was so shocked.
Hmm.
A page A4 with instructions. It says Hilfe bei psychischen Krisen und Erkrankungen. So like help by psychological crisis and sickness.
Hmm.
And it basically tells you step by step instruction how to apply to Krankenkasse for privat therapist,
Okay.
because it's impossible to get help from like a normal therapist. And they tell you that you have to collect 10 rejections, you have to have them documented, you have to submit that to Krankenkasse, and then Krankenkasse will make it possible for you to to get seen by someone who is or like by the therapist that is for private patients only, not for
Hmm.
publicly insured.
Yeah.
And I'm like, are you flipping kidding me? Like, if I have a
That,
problem now, I'm not gonna go
yeah.
around collecting 10 rejections. I already waited for this termin by Hausarzt, God knows how long. Then I
Mm.
have to submit it somewhere to Krankenkasse and then wait for them. I was like, no, I'm gonna pay 40 euro and I'm gonna speak to a Polish therapist right now, because A4 printed, that means that like they hand it often, no? If they
Yeah.
decided to like have it printed.
It's all a person struggling with mental health needs is that. Like, here, a
Right.
full of instructions that will get you nowhere,
Yeah.
but you still have put mental energy into it. Like, makes
Yeah.
no sense. But to be honest, my experience in Germany was very different. Like in Portugal, if you need mental health support, you have to pay. There's really no way
Yeah.
around it.
No, I
Luckily,
think.
private insurance
Yeah.
is very cheap here. And for example, I can get appointments online for 15 euros. So still, I have to pay for myself. When I was in Germany, I went to a private therapist that I knew accepts also public insurance. The question is, they have really long waiting lists. So my process, and I had a friend doing the same with my therapist just recently in Germany. What he does is he told me, listen, I have a 6 months waiting list. I will give you an appointment to assess your situation and then we see. So he gave me an appointment right away, like a couple of weeks in. And after the appointment, he said, okay, I will squeeze you in. I'll put it on top of my priority list. And I was like, oh my God, it's bad. It's horrible. Why is this speeding me up, you know? And then and then he explained to me, he said, no, like the thing you're dealing with right now has to be taken care of right now. It's not
Yeah.
someone that had depression their whole life, 6 months more, 6 months less.
Yeah.
It won't make much of a difference. Of course, it's
Yeah.
important. Not saying it's not important, but in your case, and this was when I was recovering from an abusive relationship, and he said, in your case, has to be done now.
Yeah.
So he wrote my health insurance. I had Techniker Krankenkasse, and he wrote my health insurance and told them she needs therapy and needs it now. And they opened like a block of appointments. So they gave me first 12 appointments for free. And then after the 12, we sent another letter. And then I got 24 appointments for free. And then
Okay.
we went on and I did therapy for 5 years like this. And
Yeah.
I never paid a
And
cent.
I actually approached your therapist because you gave me the number.
Yeah.
And I could have seen him, but the problem is exactly that he's booked out 6 months to
Mm,
the ahead. So he
yeah.
was like, if you want, I can give you an appointment when someone cancels. And then at like 10 in the morning, he would be like, hey, I have an appointment at 12. And I'm like, oh, sorry, I can't make it. And then the next day, hey, I have an appointment at 5, but it was already 4 and it takes me 1 hour to go there. So I knew it will not work. So I just
You
directly
can do it
approached
online with
someone.
him. Sorry to interrupt. You can do it online with him.
Yeah, but I didn't want to. I
Okay.
wanted to go, and if I, like in Poland, I have to do it online, and because I don't want my partner to hear.
Mm.
And I would have to speak English. So now he takes care of the baby, and I just speak Polish. He has no idea what I'm talking about.
Yeah, okay.
So it works. But actually, here on this page, they also, this is not the only information they give. They also say, like, if you need to go to Tagesklinik Behandlung, so like you need to be admitted,
Yeah.
it will take around 8 weeks, but after you like search for whatever, it kumuliert, so it accumulates to
Yeah.
durchschnittlich 3 to 4 months. Imagine you need to be admitted somewhere for addiction or whatever,
Oh,
and
wow.
you
Okay.
need to wait 4 months.
Bye. Ciao. The thing is, like,
Yeah.
knowing how postpartum depression is normal. Not saying that it's the case, by the way. I'm just saying it's just way more common than most people think. I'm learning now about postpartum anxiety. Coming back to your intrusive thoughts, I still have them and pretty bad. And I'm getting into that topic of postpartum anxiety, which I did not know about, and it explains a lot of this intrusive thoughts, which in my case, I don't know if it's the same for you, goes beyond the intrusive thoughts. Is one, you have them and you picture your baby dying 5 times a day, but also you feel like because you have this picture, it might happen. You're manifesting it.
Yeah. I know
So
what
like
you
it goes into a spiral, and it's just like it's
mean.
crazy. So like knowing that moms struggle so much with mental health, shouldn't the health insurances be prepared for this? Shouldn't we have like shouldn't the like you have an EBAME, right, included in your insurance that helps you through the first weeks after the birth?
Yeah.
Shouldn't you also have a therapist on call that you can, right?
Yeah,
Shouldn't it be
right.
included? I
And
think
you know, I was so ashamed of having these thoughts. Like, I didn't understand why. I'm just so happy to have this baby now, and we got home and everything is fine. And like, whatever I take her, I pick her up. Like, I walk through the door, I see her slamming the door frame, you know? Like,
I
I
know.
was so ashamed that I imagined her dying so much that I thought like if I tell some doctor that they will like take my baby away, you know? And then I told my partner after I think a month, but I was really struggling. I was crying when I said it, and he said, "Oh yeah, I have it too." And I was like, "What? What do, what do you mean you have it too? It's normal?" And then I started talking about it a bit more, and apparently it's normal. And
Yeah.
yeah, now it
I
really helps to talk about it, but it's just so horrible to see it, you know,
Yes.
because your brain like really imagines, like you see it, you literally see it, you know.
Yeah.
It's terrible, no?
I had the other day something with her being stabbed, and I was like, I could really like almost feel the blood of her being stabbed. And then again, it comes this I believe in manifestation. I believe that when you really like see something clear, you can manifest it, you can make it happen. And that's how I achieved many things in my life. So now I'm like, oh my God, she's gonna die. Like I'm so afraid of her dying, and I think about her dying so often
Yeah,
that she might die because I'm manifesting
yeah,
it. It's like I want, and it's horrible because you just keep carrying this, like it just makes it worse. It
yeah,
boils up, and my daughter is going to be 18 months old soon. So I would hope that, this gets better over time. It's not happening. I don't know. It's not really getting so much better. So maybe I do have postpartum anxiety. I don't know. Like, I
yeah,
think one of the fun things about this podcast is that we don't have to have all the answers figured out.
yeah. I
We are
definitely
not here
want
to
to.
tell people like, oh, you have this is how you should be. That you
Yeah.
have that, this is what you should
But to
do.
be fair, like if I find out about Schreiambulance, I'm gonna share. So.
Yeah, exactly. Of course, the
Yeah.
things that we
But
know
when I
work
needed
for us.
Schreiambulance, I didn't know about it. And there were times, I was crying, the baby was crying. My partner would come home and see both of us crying on the floor. And then I'm like, I hand in the baby and I go outside because I just can't take it anymore, you know?
Yeah. Yeah.
Yeah, she was going through a growth spurt, it turns out. One day she woke up and she was okay. Gone. I was like, how does this work?
Yeah.
Crazy, no? But you mentioned something about blood, and I actually said the last episode that I wanted to talk about it to you because I was going through a bit of a down recently because I got my period back, and I was like, this is way too soon. I was not prepared for this. And this whole blood situation, I don't know why I had no idea that it works like this. So after giving birth, I was bleeding for weeks. I had no idea that you bleed for weeks. Why did no one tell me?
Why
I
no one?
thought like I thought like you don't have period for 9 months when you're pregnant, and then you just wait for a year or whatever, and then
Yeah.
you get period. Not like you give birth and you bleed for weeks. I was like, what? And then I was bleeding for, I don't know, 6 weeks maybe. And then what? She turned 3 months, so 6 weeks of a break, and I got my period. And I just finished actually, but it was the longest and the heaviest period that I had in a long time. Before I had periods that were like 3 days long and very light. Jesus, I struggled with this one. It was from Sunday until Friday. And it's so much. I had to change. I have period underwear. I had to change multiple period underwear during the day. It was horrible. Nobody prepared me for this. And also, I thought like if you breastfeed, you cannot get period, but you can.
You can, you can. I think it also depends. Like the more you breastfeed, the less likely it is that it's gonna come so early. But it depends. Everyone's body is so different, and it's normal that like if you're bleeding a lot now, it doesn't mean you will bleed a lot always.
Yeah.
It really depends. Your body is still adjusting, still adapting. It took me a little more. So, first of all, the bleeding after birth. I went to the emergency room 2 weeks after my daughter was born because 2 3 weeks because the bleeding that you have after giving birth changed color, and at some point I had some sorry, too much information, but it started to turn a little greenish yellowish thing. And I didn't know. It's normal. It's part of, it can happen. So I went to the emergency room. I said, I have an infection and I also have birth trauma. So I have panic attacks when a doctor touches me. But I was like, I have to push through it because if it's an infection, it's just going to get worse. And then the doctor will, have to touch me even more. So like I pushed through my panic attack. The doctor was kind of patient, a bit rude, but still patient enough to help me through the exam. To then, at the end was like, oh, the coloring change is normal. Why no one told me about this? Why did I
I'm
have
gonna
to?
take you on a trip. You continue your story. My baby woke up. I'm sorry.
Yeah, so it was really, really annoying, but I pushed it through. And then after birth, I started taking birth control. So that's
Okay.
why I didn't. Oh, hi, dear.
Okay. Off we go.
I started birth control, which I now regret a lot.
Really?
Yes.
Why?
It made me extremely depressed, mood swings, bloated. I gained 32 kilos in my pregnancy. I was still like not. I dropped 20 kilos really fast, but it was still very, very bloated and holding water. The mood swings were horrible. I had really very depressive moments. Luckily for me, I have one of my best friends has a baby 2 weeks difference from mine. She's oh my god, this little noise is so cute. And she was having exactly the same symptoms, like days that she would just cry and feel fully depressed. And then we talked, and I was like, wait a minute, this is not, there's something else. You cannot be just, oh, it's normal, you're a new mom. Like, no, there's something more here. So I stopped it. I first switched the pill, and it got better. It got a little better, but still I wasn't feeling like myself. And I was still not like my body holding a lot of water, very bloated everywhere, still having very depressive moments. And then I said, you know what? I told my husband, it has to stop. My body's not doing well with this. And I stopped birth control, and it's like a couple of weeks in, and I'm a changed person. I'm a different person. My body went back to what it's supposed to be. I still have moments that, of stress. I'm a new mom with a business to run. Like, of course I have moments of stress and anxiety, but it's very, very, very different of what I had when I was on birth control. So I really, really regret it. And I fear that maybe a lot of women do think they have postpartum depression and are struggling, blaming themselves for the struggles that they are having, blaming themselves and their babies, when sometimes it could be birth control that is affecting them. So, but again, many times you are dismissed by everyone because it's like, oh, you're a new mom, it's normal, it comes with it. Oh, it's because you're breastfeeding, or it's because your baby doesn't sleep, or it's because, like it's difficult to find the line between what is real, what is your hormones or your birth control or etc. So it was really a big struggle for me, I have to say, until I stopped birth control, and now it's more easy for me to distinguish when it's hormonal and when it's not.
Okay. Yeah, I'm not on birth control for years now. And I'm not I'm not going back on it anytime soon because I somehow want to settle in this, But I really struggled very first few weeks after giving birth. I was crying a lot. Now it's way better, way better. I also sleep better since she sleeps in bed with us, Yeah. And now I have help. I talk to I'm feeding her, by the way. I hope now you can't see.
No, you can't see anything. But the
It's
noise is
probably the only podcast where there is someone breastfeeding on while recording. But yeah, I feel like it's way better already. We just had a tough night, like super tough because of the vaccine yesterday. And
yeah.
I also get this help from the therapist now, so I get to talk to someone who's
That's
not my
awesome.
partner. Yeah, and now I also talk to you. It also helps, I feel, because yeah, I
Yeah.
sometimes I really thought about it last time when I was talking to you about the breathing monitor, and you were so surprised, and I was like, wow, for you it's surprising, but for me it's like it's normal. For me, I talk about it just like I talk about I don't know what I had for breakfast. It's
Yeah.
just my reality, but because it's my reality, yeah, for me it's normal, right? And
Yeah.
I don't really know other people's reality.
Yeah, exactly. Yeah, I think that makes a big difference to understand. And to be honest, social media here plays a role like the saint and the devil, because I hear a lot of horror stories that I wish I didn't know. At the same time, it helps sometimes when you find the good content, like it helps you feel more normal and understand. And it's relative, your experience in comparison with other people.
Yeah.
Not that I'm like competing with anyone or trying to compare, but like just to understand that other people go through the same or even different challenges that I don't have. Like it helps in a way, but of course talking about it, and I think it's
Yeah.
really great that you even mentioned that you're search for a therapist and you start a therapy and like just be open about it and help other women understand that it's normal that you might need that support. It's just part of it.
Yeah. 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 But I also find that talking about some things can scare other people. I have a friend
Yeah.
who really wanted to be pregnant, and then she asked me about my birth story, which I told her, and then the next time I saw her boyfriend, they're like, yeah, maybe we will wait because she realized it's hard and maybe it's harder than she is prepared for, so we will wait. And I was like, oh no, did I do this? You know what
Well,
I mean? But to be honest, I told him that I have a group of like 200 girls on WhatsApp, and from all of them, I think I'm one of the like top ones who had it the worst. Most of them have easy pregnancy, they give birth, everything is fine. It's rare that this can happen, that you have who have it super tough, but it can happen, and she should also know that.
yeah. Yeah, it can happen. That's the thing. You never know with pregnancy. Even like you had 2 kids and you had a good pregnancy doesn't mean the second will be better.
Actually, I have a friend. I don't know if she's a friend. Like I met her at the hospital and we text sometimes. Shh, baby, shh. And she had 2 kids. Okay, sorry. She had 2 kids, and then with her third kid, she was in the hospital for 6 weeks before giving birth,
Wow, that's
and
horrible.
then for 2 weeks after giving birth, and she also gave birth prematurely. I met her because her baby was together with my baby, and I was like, she had 2 kids at home, and for her, not only she had to lay in the hospital for weeks on weeks, She also had 2 kids at home she was
Yeah,
missing.
that's it's horrible just to
Yeah,
think about
but
it. Wow.
she said to me that she's happy that she had this kid last, not the first two, because maybe she wouldn't have. And
Yeah.
that gave me somehow hope that, for me, maybe it was the first one will be like this. Maybe if I have more kids, it can be normal,
Yeah.
because it can just happen randomly.
There's no guarantees to
Yeah.
anything. So of course you expect the best, but you have to be open that it may not go. I remember the day I was induced. I had a normal, natural, whatever you want to call it, labor. But I had to be induced. I was already 41 weeks pregnant, and she was just like, I'm not coming.
Yeah.
And I remember the day I was admitted to the hospital, there was a girl in the waiting room, and you could see the fear in your eyes, and she was so nervous. Both of us were going to be induced at the same time. And then I remember telling her, don't be scared. It's going to be fine. You are in a safe place. It's a really good hospital. Everything's going to be okay. Like, it's going to be fine. Like, I was trying to encourage her and give her hope. And then at the end, I was the one who left with birth trauma. Like, she gave birth a day before me. And I think, I don't know for sure, but I think everything went kind of smoothly. Her water broke naturally, mine didn't. They used the hand. It was horrible, traumatic.
My water never broke either. Yeah.
Yeah, so like you really never know. You really never know. Having a positive mindset helps, of course, but you never know with pregnancy.
Sorry, Steven. 1 second, maybe the other breast will work. Już masz, proszę.
It's also okay if you feel like it's
Yeah,
time.
I'll just give her the second breast. We can wrap up. But I wanted to say something because I have a similar experience. I got to the hospital. They admitted me, when I was giving birth, or they didn't know if I'm giving birth. And there was a girl there in the room, and we were both like without a baby. And she said, "Yeah, my baby was already born. It's in like some other floor, and she was telling me, I was like, what do you mean in some other floor? I thought like babies are with you, but yeah, her baby was in NICU and she was already there for weeks.
Oh
And I
no.
was like, I can't imagine this. And then she told me this story. I went to sleep. Yes, proszę. I went to sleep and I woke up and I was giving birth, and yeah. Yeah, maybe we can touch up this birth story next week.
Yeah, let's do that.
Did I tell you my birth story or not really?
No.
No, okay. Oh, and I know what else I didn't tell you. The name of the podcast. I still didn't have.
Oh my God, now it's gonna be a crazy name that I'm not. No, I'm joking.
No. The name is The Unsaid Truths.
Oh,
I even have a
that.
logo and everything.
I love
I
that.
paid for a logo. I wanted to do it already a long time ago. 1 second. I'm happy. And yeah, I wanted to already record it a long time ago. I have a logo, everything, The Unsaid Truths.
I love it.
Yeah, it's finally out.
Yeah, it's great.
Yeah.
Do you
All right,
want
I think
to?
I'm gonna wrap it up here,
Yeah.
and I will make some milk for her because obviously she's not happy.
Yeah, she needs mama. It's okay.
Okay. Bye
We
bye.
talk again soon. Bye bye.